On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman and Associates. I will be the moderator for today's webinar. Today's webinar is Tribal Long-Term Care Facilities, Leading the Response to COVID-19. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. We have 6 panelists and 1 presenter with us today. Our panelists, presenter, and facilitator include Tammy Reed, the administrator for the Morningstar Care Center, Joseph Ray, Board of Directors member with the Laguna Rainbow Nursing Center, Rosie Abdad, the administrator for Archie Hendricks Senior Skilled Nursing Facility, Tiffany Shangru, the administrator for the Oglala Sioux Lakota Nursing Home, Melissa Johnson, the executive director for the BSCG LTSS Tribal Advocate, Brandy Moran, the administrator for the White River Health Center Care Center, and we have Dr. Blythe Winchester with the Cherokee Indian Hospital Authority and Solly Care Center. And finally, our facilitator today is Ina Weed-Hurley, for the Human Resource Specialist for the Morningstar Care Center. Ina, will now turn it over to you to introduce today's topic.
Well, thank you, Julie. Hi, so my name is Ina Weed-Hurley. I am currently the Human Resource Specialist at Morningstar Care Center in Fort Washakie, Wyoming. Our nursing home is the only Native nursing home in the entire state of Wyoming. I am also the current secretary of the Unite Board of Directors. So we're going to be looking into the tribal long-term care facilities leading the response to COVID-19. So I'm going to tell you a little bit about Unite, give you a little background. So Unite grew from a group called TREACH in 2014. In 2016, we changed the name to Unite, which stands for Uniting Nursing Homes and Tribal Excellence. We partnered with KAI Kaufman Institute, which has been instrumental in helping us produce our best practices reports, monthly newsletters, and establishing a CMS website. Over the years, we have broadened our scope to include people with disabilities, assisted living, and all other long-term services and support. In 2019, Unite became a 501c3 nonprofit corporation. This will help us greatly with the ability to apply for funding. We also established a board of directors. So entering into the 6th year of service to tribal nursing homes and tribal assisted living facilities, also promoting evidence-based education and training, best practices, and quality improvement initiatives. Also working with any tribe desiring sustainable facilities and services for tribal elders to age in place. So Unite's mission is Unite partners with Native American, Alaska Natives, Hawaiian tribes to improve the quality of life of elders through the implementation of evidence-based practices and culturally relevant education and training. So Unite would be delighted to have anyone join us and become a member. And here is the contact information as listed. Some webinar objectives that we will be learning today. We're going to be learning about 3 ways that tribal nursing homes have been impacted by COVID-19, identifying those obstacles to providing care, also the challenges that staff face in tribal long-term care facilities, learning how tribal nursing homes keep tribal elders comfortable and safe, but also those challenges to transition the residents, and understanding how CMS guidance impacts tribal nursing homes. So our first question here is, how has your nursing home been affected by COVID-19? So I will ask the panelists to introduce themselves when I call on them. And so first, with a question, I have Tammy Reed.
Thank you, Ina. My name is Tammy Reed. I'm a lifelong resident of the Wind River Reservation. I've been with Morningstar Care Center here at Fort Washakie for 8 years, and we are very happy and pleased through our Unite group to be able to present this panel today. One of the greatest effects I believe COVID has had on our facility is the loss of freedom to our elders. Our facility is very, very busy in the community. We take our elders to community events, basketball games, powwows, to the casino, out to eat lunch. And when CMS and CDC stopped all communal activities and requested that elders stay in their room, that's been very hard for our elders to not be able to see family members and to not have that freedom to go over to the post office and visit with relatives or community people. They miss their families very much, and we have set up FaceTime, we've set up Skype, we've tried social media, and we have families that visit at the window. Everybody wears proper face masks, but it's just not the same as being able to have a hug from your loved one. And of course, our dementia elders, they don't understand COVID and the pandemic, and so it's been challenging trying to keep masks on them or keep them from wandering into other rooms, and so I think that's a real challenge. We are going to have a family parade next week for all community, and so our elders will be able to be outside and their families can decorate their cars and they can see their family members. We take them outside a lot. We try to do a lot of activities, and we've just really tried to address their individual needs and provide just real intense care for them. And so that's one of the issues that we've dealt with, of the many with COVID. And I'll turn it over to Rosie.
Hello again. My name is Rosie Abad. I am from Archie Hendricks Senior Skilled Nursing Facility. I am the administrator, and we are out in the middle of the desert. Our address is Sells, Arizona, but again, out in the middle of the desert. And how we have also been affected by COVID, and I'm going to agree totally with Ms. Tammy, is the restrictions. For behaviors, I can say that, yes, there was an increase of behaviors at the beginning. We did start our restrictions March the 6th, so it was quite early, and we started self-isolation of rooms March 19th, but before that happened, we actually had our primary doctor and medical director on Zoom with the residents in our commons area. They were practicing physical distance, and our director addressed everybody at that time. So there has been constant communication of what's going on in the community, what's going on in the world, and what our processes are for a gradual, very in the far future, reopening at this time. But with that being said, and it being quiet in the halls and in the commons area, we have seen that those residents that are usually agitated have actually calmed down. So it seems that there may be some mixed blessings in some of these, some of what's going on. We, of course, did all the immediate screening and the masks. Food security, well, we have seen a decrease of meat coming our way, but we're making the most of it, with the meat shortage. But we're also offering free meals to all staff. Some of our departments are working remotely. We actually have our business department that is in a different facility, in a different building on site, though, still. Again, as I stressed, we're still in a different, what am I trying to say here, where we are out in the middle of nowhere. We have our own housing, temporary housing, and housing for for some of our staff. We have our own water tank. We have our own sewage system. So even though we have the issue of family wanting to be here, it was actually quite hard for some of them to come to our area. But there are those that are very, very devoted. And for them, we know that has been a big concern. But we do have that continual communication between our community liaison, our social services department, our director of nursing, myself. So there's always that constant communication that continues up to this time.
Thank you, Rosie. Okay, Melissa.
Good morning, good afternoon, good day. My name is Melissa Johnson. I have been participating with Unite since inception, and I'm a long-term care advocate. I currently work as the executive director for Bering Sea Elders Group here in Alaska. So one of the areas as far as how COVID has affected our elders is food security. Some of our elders have transitioned into long-term care facilities where access to traditional foods may not be as prominent as if they were home either in their home communities or even in the urban settings. So food security is one of the areas where our elders wonder, especially during peak hunting and gathering times, are they going to have the traditional foods that they have had access to prior to the pandemic? And that's something that weighs heavily with our elders. And through community support, there have been different efforts to continue to connect our tribal elders with those traditional foods that not only provide them physical nourishment, but also provide connectivity to spiritual and other traditional practices. So, Quiana, for attending today, and thank you.
Thank you, Melissa, for that. Okay. So for our next question here, what obstacles have you experienced in providing care to residents during a pandemic? So again, I will ask the panelists to introduce themselves when I call on them. Joseph.
Good morning, everyone. Can you hear me? This is Joseph Ray with the Laguna Rainbow Center Corporation Board of Directors. And I've been with the Laguna Rainbow Center here in Laguna Pueblo, New Mexico for the last 6 years. This is my second term as Board of Director member. I am currently the Vice Chair. We're a 58-bed facility located approximately 1 hour from Albuquerque, New Mexico. Our current census is 46, and one of our biggest obstacles has been for providing care has been our staffing. We've had to rely on agency nursing. For the last 2 months, we've been on lockdown. We coordinate with the Pueblo Tribal Administration as far as our operational procedures, the coming and going of our staff. You know, our staff has had to keep letters of informing the police department and anyone who's checking that they are needed staff at our nursing home. So again, it's our main a barrier for providing quality care has been agent nursing, and we've had to rely on agency nursing, which again, of course, it's a little more impersonal due to the unfamiliarity with our residents. Our residents are, you know, are unique in the fact that they do at times rely on having native speakers. The CNAs are at times native speakers, so our residents do depend on that familiarity with their caregivers. Another barrier, another obstacle has been, of course, that so many of other centers might be having, was the acquisition of PPE, the shortage, and we had some supplies that lasted for quite a while, but then again we had to turn to the market, and we found that because of price gouging, and the competitiveness of acquiring those materials, it's been a little bit difficult for our staff there at the Laguna Rainbow Elderly Care Center. We're fortunate again to have a good interaction with our tribal leadership, and again, just been able to rely on the tribal administration for some assistance. We had our just this past week we had our New Mexico National Guard come in and totally disinfect our facility, our two wings, and then our administrative wing, our dining room, and other facilities there. And so we're grateful for that from the state of New Mexico. We also had our governor of the Pueblo, Governor Herrera, provided approximately 100 protective masks. So again, doing a little bit, the best that we can. We have not had any reported cases of COVID-19 at our facility or on our Pueblo, so we're so very thankful with that. Thankful to our nursing staff and our administration there that they have followed procedures and just practice safe practices for the protection of our elders. So thanks again, Ina, for that, and I'll pass it on to the next person.
Thank you, Joseph. Tiffany?
Hello, my name is Tiffany Shangru. I'm the interim administrator here at Oglala Sioux Lakota Nursing Home for the Pine Ridge Indian Reservation. One of the biggest obstacles that we are facing is kind of the same as everybody else, I'm sure, is keeping our residents in their rooms. We're just reminding them to wear masks. We have set up, like others, we set up Skype, and for those who don't do Skype, phone calls. There has been a couple window visits, but the main thing they missed is just socializing with each other, just having someone to visit, person to person. We are lucky enough that we had enough room to have an isolation wing, because we did have a couple residents that had come back from the hospital, so we put them in there for 14 days. And the sad part was we had one that was on comfort care, and we was only able to allow 3 of the siblings into the room, and there was other family members that had to just come to the window. So that was a tough deal for the families that they had to face, especially when they're all so close. And we have 3 residents who do go out to dialysis, and we put them in, at the end of the wing and their own separate rooms, and they have to have the full PPE from the staff, so they feel a little like they're being ostracized, but we have to just visit with them and remind them that it's for their safety and everybody else's safety also. Thank you.
Thank you, Tiffany. Brandy?
Hello, my name is Brandy Moran, and I am the administrator here at the White River Healthcare Center, which is owned by the Rosebud Sioux Tribe. I've been here for probably 16 years now. and I've been the administrator here for the last couple years. Some of our main obstacles for this pandemic is our PPE. We had quite a bit in the beginning, and with putting residents in isolation, we've gone through quite a bit of that, and trying to find, like, with the outrageous prices from vendors. Other obstacles would be how to get when we first started is getting even our trucks and not having our vendors come into the facility, like even getting our rugs and making sure that we meet them at the door and making sure we're not letting anybody extra into the facility except for employees. That was one of the things that it took a little bit of a test before we closed our doors on March 11th and haven't allowed any vendors in, except for the only ones that have come in are employees and providers. Another obstacle that we had is making sure our residents that are isolated in their rooms all day, they have enough to do. That is one of the things that it could be emotional for them because they're not able to go outside and see the people that they're used to being socially with. But thank you.
Thank you, Brandy. So our next question here is, what are staffing challenges your facility has overcome? So we'll go ahead and start off with Tiffany.
Okay, so far we have been very fortunate. We don't have COVID in the building or haven't gotten it in the building. When we did get the first alert on the reservation, we had a few employees that got scared and quit, so we had to replace them. But when we did move our residents into, when we created our isolation wing and, moved the residents into other rooms, I am very proud of our staff. They all came together and they helped each other, the activities, the social services. They all helped move the residents into new rooms. Some of them were upset at having to move, but we just made it as comfortable and easy as possible. So I'm fortunate to have a great staff. I guess I'll just pass that on. Thank you.
Thanks, Tiffany. All right, Tammy?
I think our staffing challenge in the beginning, we don't have COVID in our building, but we have had an outbreak on our reservation, and it was scary for some of our staff. We did a lot of educating, a lot of talking. They have done a wonderful job, trying to stay focused, stay healthy in our community, and, trying to follow the guidelines here, which, as everyone knows, a lot of directives came from CMS and CDC, and so there were lots and lots of changes. And so that was hard for some employees not understanding, some of the changes that were happening so fast. But they were able to come together and move forward, and the few that were concerned and frightened for their family members at home that quit, we were able to replace them. For payroll, it has really helped that in Wyoming, our Medicaid did up our rates a bit to help offset, and the CARES Act money has certainly helped with the pricey PPE that we've all had to purchase. Mm-hmm. So that helped a great deal there. I think that it's stressful for everyone in going through the pandemic right now. We talk about it a lot of just, being locked down at home plus locked down at the nursing home. We all have that need for, to socialize with each other. And so, I think that we've done good. Our employees have done very well, and I'm very proud of them. And I will turn it over to the next person.
Thank you, Tammy. So, Rosie?
Okay, again, thank you. And so everyone's talking about, having to replace people when it comes to staffing, and ours, as I stated before, we are in the middle of the desert. So our big towns are from an hour to 2 hours away. So we do have a lot of agency staff. But to also offset our CNAs, we are now implementing the temporary nursing assistant program. The state of Arizona has approved that, and so we did have 2 caregivers that are now temporary nursing assistants, and we have on waiting in line up to about 10 of our staff that are going to take the TNA program, so that's obviously going to assist greatly on the floor. Back to also, we offer our free meals for our staff so they know that they're well nourished when they're here working with us. We have an assisted living residence that's on site, and back in April, we brought the residents into our home. So the assisted living residents are now nursing home residents. That helped increase staffing, that helped lessen the worry of the manager of the assisted living residence. So since they were a part of a family but apart from us, we have brought them into the fort, I guess you could say. So that also helped us get good staffing and with the assurance of all residents being taken care of under the COVID. We have incentives that we have for staff when they do pick up extra shifts on top of the overtime. We also have the COVID pay for those people that are physically in the building, and that means all departments that are physically in the building. We also have administrative leave when there are staff that have somehow come in contact with someone that came in contact with someone that was positive. So we do have administrative leave. And so when we ask anyone that they need to, or we tell anyone that they need to stay home, then administrative leave goes into effect and they are paid for their time away until they hear the results. One of the biggest staffing challenges that I've seen in myself and with the other staff is that need to physically come together when someone is fearful, when someone is sad, when someone is crying. It's hard to stay away from them. It's hard to refrain from touching them and hugging them. And that even goes with our residents that want to reach out to you and touch you and hug you. So I believe that's a very psychological challenge for staff. And especially now that Arizona has opened up, the nation here, the Thorn-Alto Nation here is still in lockdown until the 5th of June. So you can imagine that stress levels are up at this point. Thank you.
Thank you, Rosie. So how are tribal elders kept comfortable and safe? So my first panelist I will call on is Tammy.
I think trying to reassure our elders, most of them understand. We've had a lot of meetings with our elders explaining the pandemic. They watch the news. They understand that we're trying to keep them safe. We do spend a lot of time with them outside, doing a variety of games and things that meet their individual needs. Our community has been wonderful, sending gift baskets, puzzles. We've received cards and letters from all over the United States. It's made them so happy. And so we've tried to address those needs. We still cedar and smudge for them, which is very important, and just that good fresh air outside. Thank you.
Thank you, Tammy. All right, Joseph, how are tribal elders kept comfortable and safe where you are?
I think in the fact that, again, because of our great staff and administration, we follow procedures and recommendations from the Department of Health, from the CDC, and, any concern we've addressed immediately. We, again, it's just as basic as that. We had a board of directors meeting last evening, and, the report from the nursing home staffers from the various departments was excellent. Again, providing the interaction with the social services department when needed, through FaceTime, through basic phone calls, visits through the window, use of PPE, as was stated earlier, when those residents needed to be comforted, we didn't spare that. If we had to give hugs, we're doing that. And again, it does cut into our inventory, but the board did direct our administrator and the department managers to not spare the expense, especially in a situation like that, where it's key for our elders to feel, our residents, to be felt that they're still being loved. We've also recently implemented a behavioral health program for our staffers. As was stated earlier, that we're all in it for that. Many of us, because of that love we have for our elders of our community and who are now our residents, and that love extends throughout the staff. And when we're not able to hug and comfort as we had, as our residents have been used to, then again, it leads to their sadness and discomfort. So again, trying to address those needs on both ends, both sides of the table, I guess you could say, not only for residents, but for our staff, that they are able to provide proper care, addressing their mental health needs. So that's what I had to add. Thank you.
Thank you, Joseph. All right, Tiffany, how are tribal elders kept comfortable and safe?
So our activities team has been doing hallway activities. They do bingo. They have quite a bit of activities. I don't know them right off the hand, but we have had several groups bring in flowers for all the residents for each room. We've had Mother's Day. There was a small group of kids that brought out Mother's Day cards and gifts, and hopefully they'll do that again on Father's Day.
Okay, thank you, Tiffany, for that. So now we're going to ask, how have you responded to transition phases during a pandemic? And to start us off is Brandy.
Well, with our admission, we had to get to a point where our facility is pretty small, and we had to decide whether or not we were going to be able to take an admission, because when you take an admission, they made us put them into isolation for the 14 days. So we've kind of backed off on some of the admissions, just for the fact that we do have an extra room on each one of the wings, but our wings, we have a male side and a female side, and if we ever had a COVID, which we haven't had any COVID at this time, we would have to put them in that isolation. So we kind of had to decide whether or not we were going to. With the readmissions, of course, we're going to take our residents back, and but then, of course, they have to go into the isolation. The state of South Dakota has just recently decided that we're doing the mass testing for all residents and staff. We're doing that this week, and that has gone pretty well. we are making it a requirement for our employees to do it. Our biggest challenge with that was to figure out where we were going to get the testing kits and how the state of South Dakota has decided that they were going to pay for them, which helped. But also trying to get a lab, and since we're so far out away from everybody, it was a challenge. And they didn't really give us a way to do it. They just told us that it had to be done. So, but we got it done, and we're still in the process. Also, in the very beginning, our residents, they got really anxious with our staff, and they did have quite a few behaviors, like I heard in some of the other facilities. And it's just trying to comfort them. And our people are used to social, like, touching, and they're used to gathering, and they're used to eating, and that makes them feel good. And right now, they can't go down to the dining room, and they can't have that extra time, and they can't have that social time. So it's been difficult. And seeing somebody outside of a window is way different than having that touch and being able to talk to them. So that has been a challenge because we're so used to being in groups, and we're so used to, like I said, with the touching and the talking in person. And the eating, it's like you're so used to gathering and eating all the time. But those are some of our challenges. I'll pass it on. Thank you.
Thank you, Brandy. Okay, Rosie.
Thank you again. We started limiting our admissions for the end of February because of staffing concerns. And so, with the support of our TONCA board, that's the Tohono O'odham Nursing Care Authority board, when it came to time to limiting admissions and then finally to restricting admissions, it was relatively easier because of the public service announcements that we've already had in posting previously for our reasons. So they still remain, of course, frozen as of now. Now, we are in the process of having discussions regarding reopening somewhere in the far future. So we're going to have to actually look at, we consist of 3 halls. We are relatively a small nursing home, 60 bed. And so we are now in the process of just having 1 hall designated for admissions or even readmissions from appointments or hospital stays of previous residents. So, and then also with testing, we are testing this week also with all the residents and staff. We were actually able to have the state of Arizona and the county, Pima County, wanting to provide the testing for us, and that, of course, was through the outreach of our Director of Support Services, Travis Leduc. He's our EPP coordinator as well as our COVID-19 coordinator. So he was constantly on the horn trying to get this done. And so this week we should finish with the testing. As of now, as I said, our admissions are frozen, and our residents do remain anxious to the day when this is over. But again, it goes back to that continual communication that all our departments have with them, and they're able to reach out to us at any time, and that includes our families. So the anxiety has lessened, and now, of course, now it's vamping up too because of the reopening of the nation. So thank you.
Thank you, Rosie. Okay, Tammy.
We have altered our admission process. Our main goal was to keep our elders that live here safe. And like everyone else, we are a very small facility. We just have the end of one wing that we have walled off so that if we did get a positive case, we can put someone there. So we are asking for 3 negative tests before we would consider admission. If we had someone who did the 3 tests, they would have to, of course, be isolated for 14 days before they could move out of the isolation area. Now, the state of Wyoming is requiring, like everyone else, mass testing, and it will be provided by the Wyoming Department of Health, so we will be starting that. We have been testing through Indian Health Center, but we will be doing everyone on this next round with the Wyoming Department of Health. And so it has delayed admission, certainly, but I think that we have to also keep our elders safe. And, you know, our families are concerned for their loved ones, and so that's our goal. Thank you.
Thank you, Tammy. So our next question here that we have is, how have changes in CMS guidance impacted your facility? So I will start off with Rosie.
Okay, thank you. So for the surveyors, we have already received or have been in the middle of 2 infection prevention and control reviews with San Francisco. In fact, we are having one this afternoon. And of course, they just want an update on our reporting to CDC. And for telemed, the visits by our doctors and our providers, we actually have had telemed in our building for about 1.5 years. So that is through our primary doctor / medical director. So, and we have seen an increase in that because vital appointments, of course, are kept, and so of course our residents are sent out. But those appointments that come up that need to be addressed, that's gone through our telemed office. Quality measures. Well, again, we're on our window for our survey. I know it's going to be a COVID-19 focused survey, I believe. It just sent out information on that. So at this point, I believe I am so worried so much of keeping our building COVID-19 free. For myself, it just seems like everything is going to work out as long as we keep our residents safe, our staff safe. The PPE, of course, coming in as soon as possible. It just seems to myself that everything else is going to fall into line as long as we keep our primary goal, and that's keeping our residents and staff safe. Thank you.
Thank you, Rosie. All right, Tammy.
Well, we appreciate the waivers that CMS has done. We were able to get some temporary CNAs certified that can help and step in if we did have a staff shortage. We were able to get feeding assistants certified, and so those were really good, helpful measures. We have had survey, and we walked away deficiency-free, but I think it's good that the surveyors are going around to check your prevention control. One of the greatest things that came for us out of this was the telehealth, because we often have to drive several hours one way to take our elder to any specialist, and our doctors have been more than happy through telehealth to work with us, work with our elders, and it has saved a lot of time and effort and transport and whatnot. So I hope that continues once COVID is dealt with and taken care of. Thank you.
Thank you, Tammy. Brandy.
We appreciate the waivers also. We did have an infection control survey. The surveyors came in the facility. They were only here for a couple hours. The whole process was a lot different than previously, where they asked for a lot of information and asked for some remote access so that way they could go over more. We did leave and exit with deficiency-free. Our visitors and our doctors, we've most of our providers have still come into the facility, but a lot of them have tried to come into the facility either like before or and gone home and changed and made sure that they're safe to come into the facility. We are screening all of our providers when they come in, and they do have to gown up just to be on the safe side. And then the telehealth, we have been able to do a little bit with our behavioral health, and we were able to get on a iPad, but unfortunately, some of the others our facility isn't set up for the telehealth. And with the quality measures and quality improvement, it just seems like what week by week it's just different on what we end up having to come up with some kind of policy or some kind of measure with the COVID. It's kind of encompassed a lot of our time, which is to keep our residents safe. So I think it's a good thing. And we also have gotten a lot more communication from the Department of Health and our surveyors, just checking in to make sure our facility and our residents are safe. Thank you.
Thank you, Brandy. Very nice. Okay, so now I'm going to go ahead and pass over to Blythe Winchester to do her presentation on understanding the impact of COVID-19 on tribal long-term care communities. Blythe?
Thank you. Hey, everybody. So I'm Blythe Winchester, Eastern Band Cherokee. I'm the certified medical director of our tribal skilled nursing facility there, Salt Lake Care Center. Currently, we have 18 cases, or we've had 18 cases today in our community of around 13 to 14,000 people. We have 0 cases in our facility. So the first thing you'll see in the slide is a link to a new form. It's a Google Doc. It's fairly simple and straightforward. This came about initially, there was a discussion between John Johns and Cynthia LeCount and Bruce Fink about our tribal facilities and kind of keeping track of what's happening with COVID. And they very appropriately knew that Unite was the group to go to about this. So they approached me to try to help this kind of communication and process take place. And so then, after having a meeting with the board of directors for Unite and also working closely with Julie, this is the document that was created to try to help us gather information and data that Unite can have and can also use in a variety of ways. The participation is completely voluntary, and we're just gathering kind of aggregate data about facilities, cases, those types of things. The expectation is that you enter the information into the document each week by close of business on Thursday. And as I mentioned, it is intended to be filled out weekly, just as more of a tracking form, and then we'll have a monthly call to review the data that's collected from that. So feel free, to follow that link and browse. The purpose of it, as I mentioned, there are many purposes. I know as well as all of you know that we do a better job at our tribal facilities of all of the things that you've already answered questions about that relate to this pandemic, supporting our residents, supporting our staff. I think that is just inherently something that we do better. So it is important to try to gather this information, both to share within our group, but also to show outside entities like Indian Health Service what a great job that our facilities do, and to kind of highlight and bring attention to the amazing things that we're accomplishing. Also to bring attention to the resources that we need, and things like that. So there's a kind of a multi-pronged purpose for gathering this information. There are blank questions where you can enter information at the end about best practices, things that you've done in your facility, so that we can also share those and to just, be able to tell your story. So I am technology stupid, and Julie, thank God, has helped me figure out how to have access to the data now. So I apologize. I haven't had, much time to review what's been submitted already, but I have access to that now, and then I'll keep working with her so that I can actually interpret this too. But I'll tell you that so far it's exciting because we have 7 facilities that are already responding on the form, and I especially thank the 3 of you who have submitted more than one weekly response at this point, although that includes me, so I'll just go ahead and give myself a little pat. We have almost all different facility types responding except for assisted living, and they're coming from all regions except Alaska and the East. So those are the only regions that we're missing data on, and it looks like really so far we just have one facility that's reporting, cases and things like that. There have, let me see, 70% of the facilities are not having trouble accessing PPE, which is very good, but still we have, the 30% who are having difficulties. And then we do have an opportunity for you to kind of say why that's happening. And so far it's, mentioned back-ordered requests, suppliers limited, back-order. That looks like those are the main things. Some of the practices that people have put in, you've also heard about on this call, of things that people are mentioning that have been successful in terms of steps taken and practices. I will mention one thing that's been brought up is transparency with communities in terms of local news or social media and things like that, just being informative to make sure not just our residents and family, but the community knows what we're up to and how things are going. And let's see, I'm looking at kind of the steps to improve. We have a mention of discontinuing standing orders about aerosolizing procedures and, a plexiglass visitation booth outside for families and residents to be able to visit, more telemed, which you've heard mentioned already. So I'm just super excited, and I'm very appreciative for those of you who are willing, to enter this data. We'll figure out a way to kind of share it in a good, organized way with everyone. And I'm just excited to be able to track this and show all of the awesome things that everyone's doing. My contact information is on there, so feel free if there are any other, questions or concerns. And again, I have to thank Julie again for helping to kind of get this document together in such an easy way, and convenient way for us to fill it out. And that kind of ends my little portion of going over that for you guys, and I'll hand it back over. Thank you so much.
Thank you, Blythe. So again, Unite welcomes anyone to join us and become a member. So here's the contact information as listed, and it will be available after. And so now we'll go into some questions and comments.
Okay, this is our time for questions. If you have a question for any of our panelists or for our presenter, Dr. Winchester, please enter your question in the Q&A pod located at the bottom right side of your screen. So we'll just wait for a few moments while folks type in any questions they might have. Okay, and one question that has come in, and this is a question for everyone, I think, that has mentioned using telehealth services. The question is, what companies are you using for telehealth services? So I do believe, Tammy, I'll go ahead and start with you because I think during your presentation you had mentioned something about that.
Okay. We actually are not using a company. We are using a form of Skype with our technology, and our doctors call directly in, and we have our elders sit in front of the screen so that they can communicate directly with the doctors. We are able to send all their vitals and whatnot before they have the appointment, and it has worked out very smooth. It's just really been a positive thing.
Great. And Dr. Winchester, can you share with us what services your facility might be using?
Yeah, so we use a platform called MEND, MEND. which is kind of an online platform that our hospital system has purchased and allows us to use. And I also use the Doximity video dialer, which is an app, and it's free, and it does have kind of a consent, and it's HIPAA compliant, which is awesome. And it's easier for people to use because you just enter in a text, a cell number, and it kind of sends them an invite like, hey, this person's, trying to get you, so they can just click that. And it works particularly well for younger, residents, I think. But so those are the main two that we use.
Okay, great. Thank you both for your responses. I'm going to go ahead and open up to any of our other panelists if there was any information you wanted to share about how your facility might be using telehealth during this time.
This is Rosie from Arizona. As I said, that we have been using our own telehealth or telemed for about a year and a half. It has been a goal for the past 3 years, and it's finally been realized about a year and a half. We did bring it in front of the community, in front of the board, and even though at that time there was just a little bit of doubt, I guess the idea was that it was so impersonal. Let me tell you, it's really caught on, and it's very appreciated by the family, and the residents themselves. So yes, at this moment I don't remember the platform that we use, but we have an excellent IT manager, and we have the stethoscope that the doctor can hear the actual beat across to where he's at. He can actually see that on the EKG, the EKG, and the stethoscope also. Well, the stethoscope, but so it's actually become very, very, very practical at this time. It's a needed practice, and it just happened to have that timing factor to it. So it's been very successful here. Thank you.
Excellent. Thank you for your response, Rosie. How did everyone think that went so far?
I think it went well. I always think of something I want to say after we're on to the next slide, after the fact.
I thought it went well. I mean, pretty smooth. I think it went well. I felt like I wanted to conversate a little more, but I was sticking to the question, so it was good.
Yeah, I think everyone did really well managing their time. So yeah, we just slid in there and we brought it right to the top of the hour, which is totally fine. But yeah, I think everyone shared so much good information that it's really hard to ask people to stop talking from my perspective, because everything that everyone's saying is so valuable.
I agree.
I think it went really well, and to hear the different perspectives throughout Indian country, that it's not just one area, in the United States. So I like that part.
Mhm. Well, and represents us. It represents us well of how hard everyone's trying in each of their areas. So I'm glad to get that out.
Mhm. Exactly. Well, we didn't have a lot of comments over our questions from the chat box today, so everyone was a little tight-lipped there, but that's okay as well. Is there anything else that we felt like we needed to follow up on, or are we, feeling just pretty good about this one and going to move on to the next?
Move on to the next. Now we all practiced on this one, we can be ready to roll for the next one. And especially that we have a lot of really good panelists. So that's exciting.
Or whoever's going to submit notes to today's calls and further feedback, I think one of the things to share with Alaska is because we're not connected to, the 48 states, our COVID cases are delayed in coming up here, but they're slowly getting up here. So just to share with everyone that we have, even though our travel restrictions are slowly being lifted, one of the complexities, with everyone is access to healthcare providers, and access to medical care in rural Alaska. So that's a huge complexity, and that in turn can affect our elders in our nursing facilities. So that's all I wanted to share.
Wow. So it's just starting to hit up there?
So we just, in the Yukon-Kuskokwim area, there's a third case that was just identified today. And then in the North Slope area, which is like the northern part, of Alaska, north of Kotzebue, they have their first case identified today. So though our numbers are low, the virus is migrating now throughout the state, and we don't have the luxury, to just drive from one place to another. We don't have the road system, and I think one of the other parts is one of our major airline providers for rural communities. They filed for bankruptcy, and they don't provide that service too. So we have many complexities that are delayed that, so we have to work really hard to containment, and yeah.
Oh, wow. That's sad. That's too bad. Hopefully people will keep it away. I mean, I hope from the lower 48 could not all think they have to dash up there to spread it around with you guys.
Yeah, and that's the other, I'm sorry to keep going on, but we're at the beginning of our fishing season, and fishing industry is a major economic source for our state during the summer months, and that's a lot of our cases in the last few days have been related to fishery workers who have traveled from the lower 48 up to, our state, and that's our biggest concern is, out-of-state folks who are just bringing it with them because they also need to work. So,
yeah, that's tough. That's really tough.
Okay, so we are coming up on the end of our time, and we also have no further questions in the queue. So we will go ahead and wrap up our session for today. So I would first like to thank our panelists and presenter for joining us and sharing information about how COVID-19 has impacted each of your facilities and sharing information about that. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.